manufacture red blood cells more readily, so that the anemia is not as severe, and they can stabilize on that. Then you have to protect them against diseases, because they are very vulnerable to diseases. You don't want to get them sick for anything. So you protect them against bacterial infections by giving them prophylactic treatment against bacterial infections. You protect them against malaria, because when they catch malaria, it is very bad news. So you make sure they either sleep in a mosquito net, or you make sure you give them a prophylactic medication that they have to be on for life. Then you better, there are other things like nutrition and so on, and they live better. You make sure they are hydrated properly, they live better.
So in other words, sickle cell is not curable.
It's not curable.
But early diagnosis helps to bring about proper management and give the baby good outcomes. Instead of waiting to come hospital, the baby has fallen sick. Oh, that is very good. And now, Dr. Chiaga, I'm looking at the early diagnosis. Wouldn't that be a minute late? Is there a program of intervening at the level of man and woman coming together? Is there any program, Ministry of Health program in that direction before man and woman come together to conceive a baby? We will have a draft policy, but it has not moved any further, because there are still some other limitations. The diagnostics are still a limitation. You remember when we started HIV, and we were doing a test where people were information center, people will get results after 3 months, 2 months. This is almost where we are with the sickle cell. The tests are still very expensive. They are not readily available. It's difficult to say nobody should marry before they test. You will get defeated before you get started. So what we are trying to do is diagnostics cheap and regular, available and accessible. Because we have just launched the global sickle cell effort the last month of May. On the sites of along the World Health Assembly. And actually, our minister was the keynote speaker. Uganda was selected as a flagship country, and we made a big advocacy for more research. So we hope the research world is going to also advance. Things will be better, not in the far future. Thank you very much. We're going to take a break. When we return, Dr. Chiaga is going to be telling us about the World Sickle Cell Day celebration that I held last week in Uganda. Please keep it here with us. Share the link with your family and friends. Let them come and glean on this information. Thank you. See you in a bit.
Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Juko. Check the shopping, man. What's your secret?
Haven't you heard of the parish development model, PDM?
Yes, I did, but I thought it was just a talk.
No, Sematia. It is real. I and a few friends together formed a circle, accessed money from the PDM, invested in a poultry project, and now things are moving.
Juko. I thought I was one of your friends.
You are.
But you left me behind.
I didn't leave you in poverty. What you do, just visit your LC2 chairperson and your parish chief, and start the process of economic transformation. Just like that. The parish development model is an initiative from the government of Uganda through the Ministry of Local Government, designed to transform all lives of Ugandans for the better. PDM, my parish, my development, my life.
Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Thank you for keeping it here with us. And it's a joy having you or having us in your sitting rooms this evening. And my name is Dr. Joseph Gavin Nyanzi, and in studio with me tonight is Dr. Charles Chiaga, the National Coordinator of Sickle Cell Program at the Ministry of Health. And please share our link, the Doctalk show on YouTube as well as Facebook. Share with your friends and family so that they can benefit from this very important message we are sharing this evening. Last week, on the 19th of of June, and it happens every year. It was set apart as the World Sickle Cell Day. Here in Uganda, the day was celebrated on the 22nd, that was Thursday, 22nd of June, and a lot of things happened. And we also had a theme. The theme for 2023 was home and hospital care for sickle cell disease. Home and hospital care for sickle cell disease. So Dr. Charles is going to really fill us in what happened last week and what are the benefits, what good points do we have from last week that will carry us till next June in 2024.
Yes, well, thank you very much. For every year we celebrate the World Sickle Cell Day.
Okay.
And
what is the science, the logic about these days? I know there are different days. What is the purpose of having a World Sickle Cell? I know other diseases also have days, but why? What is the logic behind that?
Yeah, when the global community sits and understands the impact of a disease condition on communities, they classify these diseases accordingly, and they see those diseases for which there's need for focused work on them.
Okay.
By creating awareness and advocacy, and generating momentum for interventions, as well as giving hope.
Okay.
So these days are set apart to remember.
Okay.
Because these diseases could be impacting a section of community without other people paying attention.
Okay.
But it is a moment to remember, to call to action all those people that are made to act, and cause people to understand the plight of the people that go through or that are impacted by this condition.
And this is what we're doing last week.
Yeah. So it is really a moment for us to focus on what we are doing and what impact it is making, what we should do different. It is a moment when all the stakeholders gather, and especially our key stakeholders, the warriors, for us to listen to them and for them to listen to what we are planning.
The warriors, you mean those that are living with sickle cell disease?
Yes.
Okay.
Why we call them warriors, it is a fight. You must have a will to live with sickle cell disease.
Okay.
It is a fight, and it's a fight every day.
Okay.
We celebrate the warriors, and we want them to know they are not suffering in silence. They are not suffering alone. They are all of us together with them in this struggle. Okay. And we are doing everything it takes to make sure that we lessen the suffering.
Okay.
And as you could have noted, because it was aired live, I know many of us were able maybe to tune in. There were messages of hope. Okay. To show that a lot is happening locally, nationally, and also globally. Okay. And you must have heard the message from the minister, how we launched the previous month of May, how Uganda was picked as a flagship country by the global community when we launched the World Sickle Cell Coalition. Uganda was selected, and our minister was there, gave a keynote speech, and a lot of advocacy around all that needs to be done to turn the tide against sickle cell disease. You must have caught wind of that in that session.
Thank you, Dr. Charles. Yeah, I know the theme for this year's celebration or commemoration of sickle cell disease globally was home and hospital care for sickle cell disease. Maybe please enlighten our viewers more from what you shared.
Yeah, the theme actually was not global, was our national theme.
Oh, thank you.
Every country comes up with their own theme.
Okay.
So our theme, the riding theme for this year, we usually generate a theme that runs us from the one sickle cell event up to the next one. Okay. So for this coming year, for this year beginning now up to the next event, one sickle cell event, is home and hospital care for sickle cell disease. Okay. But more emphasis on home care. Okay. Because there's a lot that should be done at home to avoid being in hospital. If you don't do the right things at home, you'll always be in hospital. And being in hospital all the time is a big inconvenience Because caring for sickle cell takes a lot and needs a lot of resources. If you are always in hospital, when are you going to have the resources to provide the basic care that is needed? So we want to emphasize on home care, and when we do home care right, hospital care is reduced. And of course, that lessens the suffering of the families that are patients, but as well as whenever they are in hospital, it also impacts on the health services because they occupy these beds for long. The hospitals you go and the pediatric ward, over 50%, they are sick class. Or even more than 50%. So we want to reduce that. And to do that, we are promoting home care.
What does home care involve?
So the basic care, routine care, prophylactic care that you're supposed to receive from hospital is administered at home. Like the folic acid you're given, the antibiotic prophylaxis and malaria prophylaxis is supposed to be given at home. We want to emphasize to the parents that these medications must be given. You don't wait for this child to be in pain and then you remember they should take folic acid. They should have it. Even when they are okay, they are jumping, they are laughing, they are running around, they should be on this medication.
That's right.
Then secondly, you're supposed to improve the feeding of these children. The nutrition should be better because these cells, the defective cells are destroyed very quickly, and they have to be manufactured in new cells every time. So they need better nutrition. Their nutrition should have a high protein content, because a big portion of these cells is protein.
That's right.
So they should have a very high protein content in their meal. Don't just give them cassava or posho, and you see the stomach is full. You go. For these ones, it's not only that. They need a balanced diet. You need to give them eggs. Eggs is a very high protein source. If you can afford fish, meat, please provide. But if that is not possible, give them beans. Beans is okay, soya, and whatever. All that has protein. But protein in meats is higher than vegetables. But also give them fruits so that they can have vitamins. Give them greens. They can have irons and all those micronutrients. But make sure they are hydrated. A sickler should never have low volume or low liquid volume.
So the hydration is very important.
Very important. So make sure they drink. They should drink water, they should drink tea, they should drink juice, but not alcohol. It should not be alcohol. They should drink all the others apart from alcohol. So make sure they are properly hydrated. Make sure you protect them from very adverse environment conditions, like if there is a lot of cold, if it is very chilly out there, for a sickler, make sure they are warm, because that aggravates, triggers attack. And then also make sure that you protect them from invasive exercise. If they are doing a lot of manual work, give them less. Don't let them not be overstretched physically, because that can be also a trigger to crisis. So all that care together is what we want to emphasize. And when you do that properly, you have less time in hospital, or you may even forget the hospital most of the time.
Amazing information we are getting today from our specialist, Dr. Charles Chiaga. And he's reminding us of the theme that was launched last week during the World Sickle Cell Day celebrations. And it's very clear that actually for those parents who are having sicklers or children who are suffering from sickle cell disease, home care is able to keep these children very healthy. So let us just stick to that. Otherwise, we'll be back in a short while. Please keep sharing the link as we take this break. Thank you very much.
Qualified, professional, and compassionate doctors talking real solutions to real health problems. Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Wow, thank you for keeping it here with us. In studio with me is Dr. Charles Chiaga, the National Coordinator of Sickle Cell Program at Ministry of Health. And our discussion this evening is basically about sickle cell disease, which is commemorated in the month of June. Here in Uganda, we had it last week. A lot has been shared. Please, if you've not yet shared the link, there's still an opportunity to share the link with your family and friends. And I know the Ministry of Health is doing a lot, or has a lot in plan as far as sickle cell disease is concerned. And I would love Dr. Chega just to bring the public to knowledge, up to speed.
Yes, ever since 2015, when we did the survey and quantified the burden and how spread it is across the country, we have undertaken a number of interventions. And as I alluded to, we have already started clinics. We have over now like 100 clinics that have been capacitated to take care of sickle cell disease. We have started a model we call Centers of Excellence.
Okay.
And these Centers of Excellence, these are regional hospitals in these very high burden regions.
Yeah.
And we have 7 of them already we have set up, and we are trying to improve care to a level that we want to call a Center of Excellence.
What are the 7, if you don't mind?
The 7, we have, of course, Labo, we have Jinja,
Okay.
we have Mbale, we have Soroti, we have Lira,
Okay.
we have Gulu,
Okay.
and Masaka.
Awesome.
These are our Centers of Excellence. And we have now started working with the PNFPs.
Okay.
Actually, after next week, we are going to train. We are also setting up Centers of Excellence in the Catholic Medical Bureau and the Protestant Medical Bureau.
Wow.
We are increasing the tentacles of the reach of services, and also within our public system, we are setting up more. We are going to set up another 3 Centers of Excellence.
Okay.
That is around Kayunga Regional Hospital. We'll set up Arua, and then we'll set up another, I think, Mubende.
Okay.
Those ones will be coming on board in the course of this year. And we'll be setting up more satellite clinics.
Wow.
So against every Center of Excellence, we set up another 10 satellites within their catchments.
Okay.
Major hospitals and health centers within there. And they are being supported by the specialists from these Centers of Excellence.
Yeah.
So that's the way we do that model.
Okay.
And we are doing newborn screening within these clinics. Each one of these clinics are doing newborn screening.
Every newborn baby is screened for sickle cell disease.
Is screened.
Okay.
And that's why I appeal to the parents, please go back and pick those results and be given the information you need to know what to do with this baby. Whether it is negative, or it's a carrier, or it is sickler, it is good information. And the good thing, these results never change. It's not like HIV, that after 6 months it might have been, it could have changed. This one, if you're a carrier for life. Okay. If you're a sickler for life. If you are normal, you're normal for life. Like now we are talking about premarital testing and counseling.
Yes.
If you were tested when you are young, that result still works. Even at that time when you are looking for somebody to marry. Okay. So we are encouraging, please don't take these results lightly. We are already money is being paid to make these services available. Okay. It pains us to go to these hospitals and we find a pile of results that mothers did not come to pick them. Why wouldn't you pick these results? If your baby is normal, even when it comes to marry, you just pick out that certificate, that result, and you say, well, for us, we already tested. If it's a carrier, you know. If it's a sickler, is even very important that you know, and then interventions are done. So we are doing advocacy in terms of passing information. And through the advocacy, we are doing it locally here, and we are doing it internationally. Okay. The Ugandan story has gone rife out there. Okay. There is no country within the sub-Saharan Africa that has framed sickle cell like Uganda. Other countries have got efforts that have been spearheaded by NGOs, civil society, research groups, but there is no country that has framed sickle cell at a national level like Uganda. This is why Uganda was selected by the global community to be the flagship. And by doing this, advocacy is happening to see that Uganda can receive funding to roll out nationwide sickle cell programming. And we are already in discussions, and we are already working with a World Bank grant, a World Bank project, where sickle cell is going to be a thing. Okay. When that happens, we are going to be able to do universal newborn screening. We are going to provide hydroxyurea for everybody. We are going to set up clinics everywhere. This is where we are heading. Okay. And they want to see Uganda's success story, so that they use the Ugandan story lesson to help other countries.
Wow, this is
what we launched actually in May in Geneva.
This is super exciting, and it gives me, and I believe all the listeners, all viewers, hope. You know, we started at like 25,000 new babies born with sickle cell disease every year, but with all these strategies, I believe this is something that will be reversed with time. And so kudos to the Ministry of Health of Uganda. Dr. Chiaga, I know we're about to come to a close, but I would love you to speak to the viewers. Is having my baby diagnosed with sickle cell disease a death sentence?
That has been almost a norm before, and usually parents would lock up even these children and they are crying in the houses because they are just waiting for them to die. But that should change. If you have a sickle cell baby, please don't lock them up. Yes. Take them to hospitals, and we are capacitating hospitals to start providing care. We are giving them the logistics, the drugs and everything, so that care becomes a routine thing. Okay. Please don't ever think when you have a sickler that you know this one, we are just trying a few, just hanging around, but they're going to die. They should not die. And a sickle cell child is a normal child like any other child. Now, being a sickler is like somebody being short. When you are short, you may not be able to touch this height, but there is a way to get there. Oh, yes. You can have a stool and touch where you want to touch. This is what we are trying to do with the sicklers. Sickle cell is any inequality of any sort. There are so many inequalities in society. Oh, yes. Not all of us are measuring up to whatever every other person is, but we maneuver and still survive. Oh, yes. So this is the same approach you want to use. A sickler is a normal child like any other child. In school, please don't disaggregate them. Don't stigmatize them. They are usually even very bright children. Oh, yes. Please don't chase away children because they are sicklers. They can be stabilized and they can complete their education. In Western world, no child dies, nobody dies because of sickle cell. People grow to fullness of their life expectancy. The same should happen here. And this is what we are looking forward to. Please don't neglect these children. Some of them don't even want to take them to school. That one, why do I waste money? They are going to die. Please. And you know, when you speak negative things, you also make them lose hope.
Exactly.
And you know, life hangs around hope. If they lose hope, they have lost it. They have lost everything. And it is us, the people who live with them, that give them those negative information that makes them lose hope. But we want them to have hope. Oh, yeah. And the sicklers, please know we are there with you. We are fighting together with you. Don't lose hope. There is hope. There is light along way at the end of the tunnel. We can see the light. Wow. And we can talk to you with confidence. Wow. It will be better tomorrow. This is very, very exciting. Our parents watching, uncles, aunties, brothers and sisters, it is our duty to trade hope to these our either children or relatives that are having sickle cell disease, to let them know that the future is so bright for them instead of talking them down. That is very, very empowering, Dr. Chiaga. We are about to come to a close. Dr. Chiaga, I would love you to give us parting shots. This has been quite very informative for me, and I believe for our viewers. Any parting shots as we come to a close of our show? Especially to the sicklers, we celebrate you, we love you. You are the reason we are working day and night, that things become better. Don't lose hope, don't give up, just hang in there. Hang in there. Help is coming. Help is on the way. Wow. Parents, families, know help is on the way. We are not rested, we are working day and night. And we assure you, the advocacy we are doing is yielding. There is hope, we can see it, and we can talk with confidence that it will be well. So please hang in there. We encourage you, if you are thinking of somebody to partner with in childbearing, please go for a test. It could be a cost, but it is better than to go
worthwhile
blindly.
cost.
It's a worthwhile cost. Because if you go blindly and you get yourself into this kind of a situation, you will not avoid the costs. And there will be the suffering that goes with it is something you would not want to have, especially if you could make a decision otherwise.
Wow.
So please do a test. There are places where you can do a test. They are still a bit expensive, but we are also working
To bring down
the costs. We are working very hard. We've been working on the drugs. We have worked on the hydroxyurea, which was like 2,000 a tablet. It's now like 600.
Wow.
Okay, and we are making even this drug now available free in these centers I'm telling you about.
Okay.
So we are. We are making it free so that you just go there and receive the medications. We are not yet having enough for everybody, but at least we are sustaining. And as we go by, within the next few years, things will be better.
Wow. Thank you very much. Dr. Chiaga has been our guest this evening. He's the National Coordinator for Sickle Cell Program at Ministry of Health. And your host, Dr. Joseph Gavin Nyanzi. It's been a pleasure having us in your sitting rooms, and please hope the information has gone home and you can share and empower with your friends that may not have been able to attend this show. Otherwise, we will keep it at the Doctalk show for now. Till next time, bye-bye and God bless you.